Hey everyone, thank you for joining us. I'm Louis, and I'm here with Zhihong and Akshay, and we're so excited to introduce you to Cognita. We started Cognita a year ago because healthcare is facing a huge global capacity problem. Over half the world does not have access to sufficient healthcare, and even in places where people do have access to healthcare, resources are being stretched extremely thin. We all know this from trying to book an appointment and having to wait 6 months to see a doctor. And this is especially a problem in radiology, which is really the diagnostic pillar of healthcare. Even in places where there is access to medical imaging, the volumes of imaging are increasing exponentially year over year, but the number of radiologists is not increasing. So there's this huge supply-demand mismatch, and clearly this is not sustainable. If we don't do something soon about this, the problem will get much worse. And this problem is being faced today by patients. Patients are having to wait weeks or months to get results back, and they might be waiting on something extremely important, like whether they have a cancer diagnosis or not. And on the physician side, physicians are totally underwater. They're seeing their caseloads increase every day, and they're having to move extremely fast just to keep up. So they're forced to make a trade-off between moving fast and being thorough. And when they're making this trade-off, unfortunately, diagnoses are going missed that we wish were not missed. So we started Cognita with the mission of increasing the world's capacity of healthcare. Stage 1 of our company will focus on doing this within radiology, where you think the need is extremely acute, and also AI can have an enormous impact. Most of the AI radiology companies out there today are working on narrow point solutions that look for specific findings. So they'll look for nodules or fractures in medical images, but we want to do something very different. We want to build models that emulate human radiologists. So they look for hundreds to thousands of potential findings in medical images. They describe the visual appearance, severity, location, and even compare to prior imaging studies for the same patient. But the goal here is not to replace human radiologists. Radiologists and AI systems learn extremely differently, so we feel strongly that their strengths are complementary. The goal is to create co-pilots that increase the accuracy and efficiency of radiologists and hopefully make their jobs more enjoyable. So we think if we do these things, we have a real chance of increasing the world's access to healthcare. And with that, I'll pass it along to Zhihong, who will share more about her journey over the last year.
As Louis mentioned, the problem we are tackling is challenging. It's easy to build a prototype, however, it's difficult to develop a production-level system that can function effective across diverse disease, body parts, and modalities. About a year ago, we realized that we had our work cut out for us. Patient care is about accuracy and also about efficiency. We needed to design a system in a more scalable way. We were fortunate to have several essential parts come together. First, our close partnership with radiology partners enabled us to develop hand-in-hand with an excellent group of radiologists who are experienced in AI evaluation and deployment. Second, the partnership also helped us to collect diverse and representative dataset. Third, we've secured an exciting collaboration with AWS for the infrastructure to train our model. In just 1 year, we've built models that can emulate radiologists to interpret X-ray and CT scan. We are excited to share the results we've seen in the past year. First, for patient care, up to 67% more true positives are detected with human AI collaboration for significant findings. Second, our models standalone achieve up to 4 times fewer diagnostic errors compared to baseline radiologists in the real-world clinical practice. Third, we achieve this without the loss of radiologist efficiency. We've seen an improvement in efficiency of 11 to 69%, and radiologists have reported a reduction in mental burden. We are excited about the future with enhanced accuracy and capacity for patient care.
Building off the fantastic progress that Zhihong and Louis have described, we're really excited to look at the next chapter for Cognita, where the focus of our company will really be on scaling the technologies that we've built so that as large of the population of the world can benefit from these technologies that we're developing. And as we look toward the future vision and the mission that the company has, right now, we're starting off with trying to maximize access to these radiological findings and to be able to improve capacity of healthcare systems focusing on radiology. But even beyond this, we're excited to be able to have a much more broader mission to be able to transform healthcare. First, knowing the fact that medical images contain a vast amount of information that is just untapped upon. We want to be able to build technologies that can truly understand these medical images to be able to extract all the salient insights that can positively improve patient outcomes in the future. And then, acknowledging the fact that healthcare data can be incredibly complex, we don't want to just stop at radiology. knowing that data sets that are essential for diagnostics and prognostics can come across radiology, pathology, can have medical records information, clinical notes, genomics, you name it. We really will be positioned to be the healthcare company that can integrate all this diverse information and to be able to build models that truly understand a patient's health. Our vision is to be able to build enabling AI technology that can really transform the lives of patients and be able to equip physicians with the tools that they need to enable that. We've been extremely fortunate to be able to work beside radiology partners who have provided us with excellent clinical insights, access to data, and just an innate understanding of how do we translate promising AI tools into the real world. Our goal is to make physicians successful with the tools that we're building, and it's been great to be able to work hand in hand with radiology partners to be able to do so. And to share some more updates, I'll turn it back over to Lewis.
So partnership with Radiology Partners has been so fantastic over the last year that we've decided to bring this to the next level. So we have one more thing to share. So in addition to this being a coming out of stealth announcement, this is also an acquisition announcement. So we will be joining Radiology Partners. We'll maintain our independence as a separate business unit, but we'll join Radiology Partners to be able to leverage the large-scale data sets that they have access to, the enormous amount of clinical time that they're able to provide, their capital that they're willing to invest in us over the long term to allow us to develop and train our models, and also the ability to integrate with their radiology infrastructure solutions that they're building as a part of their tech division called Mosaic. So we're extremely excited about the future with Radiology Partners. We think we'll have a huge impact on healthcare globally. And we also wanted to mention that if you're an outstanding engineer, we'd love to have you consider joining our team. We're an extremely fast-moving, talent-dense team. And if you're passionate about transforming healthcare, please consider joining us. Thank you.